So let's see. Let me just put on the presentation and I will start. I hope everything is going all right by now. Mm -mm -mm. So, hi everybody, this is Dr. Milos speaking. First of all, I want to thank you all from all the guys from World of Dental Association for inviting me. This is so thrilling for me. It's my greatest pleasure to be here. And thank you all for going up live, especially my friends from Serbia because it's 7:30 a.m. And thank you all for watching. So we will talk about dental photography and the importance of dental photography. I will show you a little bit of my work because I don't believe you have heard of me, and so you can see what I'm doing because the picture is speaking 1,000 words and you can see where we're going from this. And we will get to the important parts of any kind of photography in dentistry, and just stick with me and always ask any question. I will be happy to answer at the end of this presentation. So we can start with something I will show you. I'm into photography for a long time, and this is something that I did for years. Maybe now it's about 10 years that I'm doing. I stopped doing this. This is a commercial type of photography that sells. So this is some kind of galleries on the stock sites, the site that you're going to buy an image you want to use for any kind of presentation or any kind of work you want to do for a web page or something like that. So this is my friend Milan. I always want to make famous with girls and photography, with fashion photography of girls, but this is the guy who made me popular because this photo was in 2015 the main photograph of Nespresso company worldwide. This is the pictures from Vienna, Milano, and we have a friend in Beijing, so this is from there. He was quite famous in Turkey, so I have a couple of billboards in Rome and everywhere. This is I won more than 20 awards in general photography, but because all of that time I couldn't find a job in dentistry when I finished the college, when I finished the faculty, and I started doing this photography so I can make a living. So it turns out I'm talented for it, so I won quite many awards. So I'm just showing you a couple of photos that I did. I worked with models. I did a couple of editorials for fashion magazines. I worked with bloggers. I was into food photography. So these photos maybe are not important to you, but they wound up on the billboards. So if you were in Serbia, maybe you could see it 5 years ago. So this is something that I was doing and I was quite passionate about it. This is maybe my most popular photo in dental photography. It's not my best, but this girl from Russia made it with painting, and I love it. I really love it. It's a special thing when someone considers your photo so beautiful that they want to make a painting from it. So I wound up on covers of many magazines, and this is something special for me. This is something that I'm most proud of. To be on the cover of Jerd magazine. Thank you, Professor Rade Paravina, for making me so proud and my parents proud. I just wanted to show you quickly. And this is some kind of photos that I do. And these are maybe the most popular photos in dental photography, especially when you ask me, when you say to me dental photography, this is kind of image that first come to my mind. They're the most popular, they are not the most important one. This is the smallest part of dental photography and what dental photography can provide you. But they are the most popular. Some people hate it. They are saying they are not dental photography. I personally love it. It is dental photography. You have everything. You have teeth, lips, and everything that we see every day when we're working. So why not to be dental photography? It's the most popular, but the smallest part. And when you want to present something, I don't want to bother you so much with this intro and with all of these photos. When you want to present something, you can do this in a different kind of way. You can shoot in studio, you can work with model. This beautiful girl, Franca, was a model on my course in Croatia, with Joško Viskić and Nikša Ducic. If you're watching this, hi guys, hi Hrvoje. So you can express yourself if you're mastering photography in general. You can express yourself. This is a patient from my dear colleague Dr. Marija Živković, and we did something a little bit different so we can advertise a beautiful smile with this beautiful girl who helped us. And this is something that I was working lately. This is a little bit different, but you can express yourself artistically any way you want, and especially with those lips, if you invest your time, I don't know, weeks, months or years in building something that you're really passionate about it, that you're working hard on it, why not to express yourself artistically, because it's beautiful to watch, and that is the whole point of these photos. But why all this? Is this important for you? No, it's not. The most important thing is to implement digital photography into dentistry to make you a better dentist, to make your office better, to make your job easier. That is the whole point of dental photography. So don't worry about those fashion things. I'm quite familiar with it because I'm doing this for all my life actually, and that is super. If you want to pursue that path, go for it, but it's not easy. It's not easy for me to explain you how to do those images because the faculty in photography in Serbia at least lasts for 4 years, and it's not quite possible to do something in one day. But we have to stick to the most important part, and this is why is dental photography, why is digital photography important in dentistry, and what can you do with it. So this is one slide, and this is the only slide that has all this text on it, and I won't be bother you with that. We will try to make something from it, like we will imagine that we have a patient today and how we can do with it. But first, the usual question that I get: what type of equipment, what is the best camera, what is the best lens, what is the best flash for dental photography? And I like to quote famous photographer Nelson Adams for that, because he said the best camera is the one you have with you. So something else is much important than equipment. The protocols. You have to worry of some different things when you want to start with dental photography. It's not about the equipment, it's not about the settings. We all have the cameras on our mobile phones. So if you're starting the dental photography, start with your mobile phone and concentrate on the protocols. Why are the protocols important? Because when you follow some kind of protocol, when you want to document your patient, you can do it exactly the same when you first meet the patient, on the initial phase of the patient and the final phase, and maybe in between, but we will talk about it right away. So forget about the equipment if you're beginning with. Start with your phone, but be sure to buy those cheek retractors and occlusal mirrors in dental photography. This is why I didn't want to waste your time so much on this webinar to talk about the cheek retractors and dental mirrors. I made a post in this group, World of Dental Association, about the mirror and the equipment and how the shape of the retractors affects the photo that you're going to make, especially the color of the retractors. And of course the mirrors. And I have to tell you, if you're seeing those images on your right side, you won't be always able to make those photos, to make them perfect. It's not the case every time. It's not the case in most of the time, because the patient cannot open that wide the mouth and the cheek retractors. Maybe he has, or she has the smallest lips, so she cannot, the lips and cheeks are not that much elastic. But if you're starting with dental photography, be sure to buy the cheek retractors, buy the mirrors first, and start with your mobile phone. And concentrate on the most important part, that is the protocol. I will show you some kind of basic protocol that I do, and why do we do it. That is my opinion, why do we do it. But you can Google it. Google Invisalign protocol, Google American Academy of Cosmetic Dentistry protocol, learn about the protocol. We will talk about it right away. So let's imagine that we have a patient today On this image, this is my dear friend Nicola and my colleague and friend Jana. And this is just to talk about something. I don't know how much time do you spend with the first visit from a patient, but let's imagine we have a patient today. He's calling to check out for veneers or any kind of intervention. So just sit with him a little bit and talk with him. If you're already into dental photography, you can show your patient the work that you did. Because the patients today, they're coming all prepared to their office. They're Googling all the problems and they will see all different kind of images. In my case, usually the patients are coming to get no prep veneers because they read about it on Google. That is the best thing. Even though they don't have all the teeth in the mouth, they will ask for no prep veneers because they heard about it. This is the best one. I want it. It doesn't matter if you have the cavity all over your teeth. No, I want not prep veneers. That is what I want. So it's your job, and it's much easier to talk with a patient if you have some kind of presentation already prepared of your cases, so you can show your patient how each step of the procedure is really looking like. So it doesn't matter if the patient came from for 1 crown. You can show your patient all the steps, because today they're going to learn about it, see about it, and they will try to explain it to you how everything works. This is my case. And it doesn't matter if you document it and show to your patient, is it a simple case or is it a little complex case like this one, all on 6, all on 4, and you can see, you can talk with your patient a much easier way when you're showing him the images that you took. This is something that I did for fun, and I love showing this slide. This is 4 years old because this is the extracted tooth and has a lot of cavity on it. And I just removed the cavity. This is the silly preparation. If the tooth was in mouth, of course, the preparation would be completely different. But it's fun for me. It's the beautiful images. I did my best to make the filling on this tooth, and I can show my patients every step of the way that I'm going to do in their mouth. Because the patients are always afraid for something they don't know. We all are afraid from the unknown. But if you show your patient how the procedure will look like, and there will be no pain, he will understand and he will be willing to agree on your terms, and he will be knowing in his head what are you doing precisely, because you have a different type of patience. Somebody that doesn't want to know anything, just do the work. So the whole point is that when you're using dental photography, you can use it to advertise yourself, or you can use it to communicate with your patient and educate your patient about the procedures. So, of course, in the first visit, you have to do what is right, because we are the doctors of dental medicine. Take the whole medical history from your patient, take the whole x-rays. If the patient doesn't have the x-rays, send them to make the x-rays. And this is something that I'm suggesting to the people that are coming to my courses and my lecturing. If you're starting with dental photography and this is your first time, you can do this little trick with your patient when this is the first visit, and when you're doing the routine checkup. You can do in the middle of a clinical examination, you can tell your patient, okay, let me just make one image, one photo, so I can show you the situation in your mouth, so I can show you what I'm exactly talking about. Because when I didn't make the photos of my patients, I tell them, okay, you have a couple of things in your mouth, and I don't know, the patient don't want to see that. No, he doesn't want to hear about it, because, okay, doc, you told me I have a couple of things to do, but can you fix this one thing that is bothering me, and I will come in a couple of days or weeks or months or never. Because the whole point is, if you show to your patient what is the situation in his mouth, and when he sees this, it doesn't matter if you're showing to the patient on your mobile phone, just pinch in and zoom in your images, zoom in the places you want to pay attention to your patient. When the patient sees this, he will change the priorities in his life. He doesn't want to buy new clothes or new phone or anything. He will invest in his health, because that is the best way for him. And it's a win-win situation, because with a dental photography, with the photos, you can see the patient can see on a big screen or the small screen via tablet or the laptop or whatever is the configuration of your dental office, but show to your patient the situation of his teeth in his mouth, and he will be willing to work with you, and he will understand. He will not be oh, I don't know why he's talking to me, I don't see any problems because I don't feel any pain. Because usually, at least for me, the patients coming to my office, usually when they have the pain, when something is bothering them. So show them everything, and you will, with this one image, the occlusal image, you can show so much, and you will be making money and helping patients because the whole idea of our work is to help the patient. So I just have to show you those settings because all of you will ask me about the settings of the intraoral and extraoral photography, and this is the suggestion. My suggestion to you is do not learn anything by heart, because that is the wrong way. There are so many paths in photography that leads to the same results. And if you learn something by heart and don't understand how the equipment works, because the most important thing is to learn how the equipment works inside out, and you will be the master of this machine, because all of those digital things, from the scanners to the images, because the best communication with the computer is via image, via photo. Learn how to make, learn how this camera is working, and when you learn it, when you master it, you will get the results no matter what. And we will talk about how to approach the patient and the protocols today, but just to take a couple of minutes from your time. So what is all these settings? You can see the shutter speed is not changing, the ISO is not changing. The only thing that is changing, the aperture, which is the blades in your lens that is closing and opening, and letting the light in to get to the sensor of your camera. The whole idea is, if your picture is too dark, underexposed, just open up aperture a little bit. If it's overexposed, if it's too light, just close down the aperture a little bit, and you will be faster, because the whole point is to be faster and more efficient. That is how you're supposed to be. So let's start with the protocols. This is my model, most of the time my colleague Milica, who was kind enough to let me show you these images, and we can talk about it. So I will show you my basic protocol for all my patients. And again, you don't have to listen to me, you don't have to listen to anybody, just think for yourself and Google it, Invisalign protocol, and stick with it. American Academy of Cosmetic Dentistry, stick with it. Just learn why we are all making these photos. We are not just making photos, so let's go into the studio. We are dentists. We don't have to go to the studio, we don't have to do this, because the dental photography should help us in our work. So let me stop talking. Let's imagine this is a patient, and as I said earlier, let's imagine this patient came to us to do the full mouth rehabilitation or the veneers. It doesn't matter. So the hardest part is how to approach your patient. Because if you ask me, if I'm going to your office, let's do some pictures. So why? Why do you want to make pictures of me? So that is the whole idea. Explain your patient why are you going to do this and what are you going to do this. And this is some kind of way that I'm doing it. So when I do all the medical history, all the x-rays and the clinical examination, I tell my patient, okay, listen, we have to do some kind of photographs, and these photographs are for the medical documentation. Why do we need those? We need those to establish the good communication with our dental laboratory. So the dental technician who will be involving in the making of the new smile and the planning of the new smile just for you doesn't look at you as another plaster model of your teeth. We want to make your perfect teeth custom made just for you, and we want to make it right, to see your face, to see all the physiognomy of your face, to make your teeth as natural as possible. if you explain your patient why are you doing this and how you're going to do it, the patient will agree with everything, because when you point out that it is in his or her best interest to cooperate, he will. Of course he will. So we need to make those photos, couple of them, which are important to us, so we can make all those analysis of the faces, so we can be the architects of the new smile for our patient, because that is the right way, the proper way to do it. And the hard way is how to, because the photograph is only in 2D measures, it has height and width, and you're making the photos of the 3D subject, which has the depth. So you have to make your patient sit up straight and sit right in the right position. So how to do it? Usually I take pictures of my patient, not in a dental chair, but we use the chairs that we are using, one for the dental assistant, and I put my patient in that chair, and I use my chair as a dentist. So we sit in the same height, me and my patient. So I tell him, so I need you to sit up straight and look straight at me. And I will show you everything, how you need to stand exactly. So this is the simple way. The problem is, because I'm speaking with myself, I don't know if you're hearing this or seeing this, but bear with me. Usually my patient, when I want to make a photograph of my patient, is leaning his head back like this. So why are they doing that? Because they want to be on that photograph, even though you already explained them. These photographs are not for the fashion magazine or anything. These are just the medical, clinical documentation. And you don't have to worry about how you look. You're beautiful just the way you are. Your hair is perfect. Everything is perfect. Just sit up straight and look straight. Either way, even though you explain everything, the patient will lean his head back. He wants to look as thin as possible. So, tell your patient always, put your chin to the chest. And another thing, the patient is usually tilting his head. At least in my experience, he's tilting his head. So my dear friend Dr. Joško Viskić and a colleague of ours told me this trick. So when your patient is tilting his head, just tell your patient, okay, lean your head back all the way and put your chin to the chest. So if the patient is tilting his head, when leaning and putting chin on the chest, he will straight up his head. And what are you going to look at first? You have something that is called Frankfurt's plane. What is the Frankfurt plane? It connects two dots to anatomical details of the patient face, which is orbital spot, the margin of suborbital line, and with the upper part of the meatus acousticus externus, or the tragus, the all upper part of the tragus. So I have to switch my camera so I can show it to you, because we are online and I have to see myself. So oh, I'm looking beautiful. We should look at this girl all the way. So look at me. If I'm tilting my head, so I will point out those dots that I'm suggesting you to pay attention to. So this is the orbital spot, and this is the highest point of the meatus acousticus externus. So when I'm tilting my head back, when I'm leaning my head back like this, just put your chin to the chest and make these two dots like this to create a plane. So let's get back to the presentation. I hope you're liking it so far. So the presentation, Frankfurt's plane. Okay, so we establishing the tilting. So this is the proper way to analyze the face of your patient. You're not going to be able to do this right away, but just keep in your mind what you're going to look, and it will make your life easier. Trust me on that one. So I have a couple of anatomical details. This is just a reminder, because we all learn about this in the faculty, in the dentistry school. So we have trichion, glabella, subnasal, and gnation spots. Why are they important? Because you can divide our patient face on the thirds. And this is if you see the eyes, this is the line that connects the bipupillar line, which should be parallel to the floor and the Frankfurt's plane. And if you analyze your patient by the thirds, if you see any problem in vertical dimension occlusion, if the patient has worn out his teeth or has no teeth at all, the lower third of the face would be short. And always concentrate on the middle third of the face, because mostly the guys don't have hair, and you will not see the trichion spot because it represents the start of the hair. So just analyze the middle third of the face and the lower third of the face, so you can spot if any anomaly is coming up. And so the second view is with the face, is the unfast profile with a smile. And that is one of the maybe hardest, it's not the hardest thing to do, but you have to approach your patient a little bit differently. So usually I tell my patient, all right, we need this second photo to make it with a smile. I don't care if your smile is sincere, if it's the real one, if it's the fake one. It doesn't matter. What matters the most is you to giving me the biggest smile, like this. And I always showing it to my patient like this. Give me the biggest smile. Why is that? And what I'm going to do with this photo? With the photograph, I'm photographing how much space are you revealing when you're smiling. So that is important when we made the plan of your teeth, and when we get into communication with our dental technician and he starts to make the teeth, we want to make those teeth as much natural and appropriate to your face. If you give me the small smile like this, we will think, oh, this is the biggest smile, so we will make the teeth a little bit smaller to make them appropriate for your smile. This is the sentence when I told the patients like this, and when I explain it like this, they're going to smile all over around their head, because they are aware that with the biggest smile, they are involving in the smile planning that you're going to do, and they will be happy because you're paying so much attention to the future teeth and future smile of your patients. So they will be happy to smile. You don't have to tell all those jokes, because we want this photo to be exactly with the Frankfurt line and with a smile, so we can make the analysis. We can see the bipupillar line, we can see the middle face, and we can see the teeth and how they are positioned between all those parameters that we just talked about it. So usually the dental technician wants the bigger smile so he can make some kind of planning, and we are doing that also. We need to put this bipupillar line straight down and see our teeth and look at our teeth. In this case, our model is beautiful. Milica has beautiful teeth. She doesn't need any kind of work of prosthodontics, maybe the orthodontics, but if she doesn't mind, I don't care. But you can see that if you want to make a perfect smile, if you already start working with some patient, give them the perfect smile and just analyze everything. So let's see if we got any kind of feedback. All right, so the fourth view, this is the side profile as you can see it, and always consider that Frankfurt plane to be straight with the floor, so you can analyze your profile. You can see the different skeletal patterns of the patient. So in case of Milica, we have a straight profile, which is with the class 1. And this is my drawings of the class 2, the convex profile and the concave profile when you have different type of classes with a bite, the skeletal one. So the important thing is that you analyze your photos. Maybe you couldn't see anything, you couldn't see everything when you're talking with your patient, when you do the clinical examination, but with the photos everything stays. So you can, another benefits from a dental photography, you can, if you're not experienced enough, you can talk with your colleagues that are more experienced, that will help you. I always ask my friends, the colleagues, my mentors, how to approach my patient if I don't know something, if I'm even if I know, I always want to second opinion. So how can I approach my patient? And the patient will have the starting point. You can tell your patient, you will see what you paid for. You will see what we did. So it will be a good thing. You can get your dental office to another level if you, by the end of your procedure, your therapy, you can send the PDF, the presentation of your patient before and after, so the patient knows what he's paid for. And you can do another side profile with a smile, so you can see the position of the teeth. Is it important? It's not, but you can do that. So I wanted to make this thing a little bit interesting because Milica is perfect. The smile of Milica is just beautiful, and we don't want to change anything. And this is a guy that I'm usually it's interesting for me because he came in our dental office to get a Hollywood smile. He wants to do non-prep veneers from 3 to 3, from canine to canine. And so let's spend a little bit time to analyze a little bit just the photos of this patient. As you can see the impression of his left cheek that is more than the impression on the right. And you can see the smile of this patient that is not even. And this is not a hard case that you will get. Usually I get patients with no teeth and you have to make planning without teeth, and you won't be always having the perfect situation, so you can make some kind of planning, you can brag about it on the internet, or it's not in theory is okay, but it's not that in the practice because it's much harder in the practice. So let's analyze this guy. So look at the smile, it's not even, and look at the impression on the left cheek. And so this is the intraoral images that you're going to do, and this is how the patient looks like intraorally. And this is another image that I usually make. This is just a basic protocol that I do to every patient that comes to my office. And if we analyze this photo, you can see the wear of the teeth on the vestibular side of the left teeth more than the right teeth. And we are here to talk about dental photography, but we can little bit discuss about it. At least I'm discussing with myself in this way because I'm talking with the camera. Anyways. Something is wrong, maybe the hypertrophy of the muscle, maybe he has some kind of problem of the joint. Do your medical history right. So ask your patient everything. This is the left side and the right side, and the occlusal point, occlusal view, and you can see on this patient that he has no enamel left at all. So it will be wrong for us to make those veneers from canine to canine in the upper jaw, since his vertical dimension is low. So we have to make full mouth rehabilitation or something similar to that one, because we want to make it right. And the whole idea is to help our patient, not the other way around, just to make money, because you won't be happy with it. So I made this kind of, I called it smile planning. It's something you can see all over the internet. The whole idea of this one is to tell you that you can do it for yourself. If you start with a dental photography, just keep your images. It doesn't matter if your teeth is ceramic ones or the natural ones. You can use any kind of software to just crop out the teeth that you can use later on, and I will show you how. So this is the same patient, and this is the intraoral image of the dental technician that we are working with. So I can see the results. This is the picture made by me, so I can make the same picture with my patient, and it's the same equipment, same lighting, and I can use any kind of software just to crop out the teeth. Maybe I would be faster with Photoshop, but this is the Keynote. I'm a Mac user. This is the free software, and you can do anything with this. And in one visit, I can show to my patient how the smile is going to look like, something similar to that. And the whole idea is, in one visit, if you make, I don't know, maybe 45 minutes or 1 hour, so you can do all the protocol photos, and you can do this in 10 minutes or so. Sorry, I can do this in 10 minutes or so. I was not born with this knowledge, I learned it. and you will have to learn about cosmetic dentistry, aesthetic dentistry, all the principles of it, and analyze the face in the proper way so you can make this easier. It won't be easy at the start, but I'm just going to give you something to think about. You don't have to listen to me or anybody with this subject, but think about it, how to approach your patient the better way. And with the photograph is the best way to approach it. So I can see with my patient, is this is something that you are looking for? Are we on the same page? This is something that you are looking for. The results would be even better when we do this. But I'm using all the images that I made with my dental technician, and I know the results. I'm not using someone else's photos because maybe it can look a little bit better, and I cannot go with that. My dental technician cannot do it. Yes, she can, but you see where I'm going with this. You will have to explain your patient the best way, and the patient will be happy because you're spending time on him and trying to make him feel better and better. So you can send your dental technician all the protocol images, and the whole idea is for the dental technician to do the waxed up, and you can do the mock-up so the patient can see in his mouth. Most of the people in Serbia are not doing that way. Not the most, but there are some parts of the Serbia which is a little bit poor. So they don't have to afford the waxed up. But the only way is to do it with a waxed up, with a dental technician, and to put it in a patient mouth, and with a face bow, with the articulator. And we have to be serious about this situation. We have to have all the guidance with the canine, because the back teeth are protecting the front ones, and the front ones are protecting the back teeth. Because why am I telling you all of this? Because with this kind of plan, you can see that you don't have to prepare the central or lateral incisors. You don't have to. You can approach it with a less prep. Of course, it depends on the indication for all the crowns that you're going to use it. And in this way, you can see that you have to a little bit more prepare the canine, because they are over-erupted. So if you want to start with a treatment of this patient, just analyze the photos and make the right way. Do not make the veneers from 3 to 3, because it's not the right way to give the veneers to this kind of patient. He will grind it. He will do something that he will break them in a couple of months, and then the patient will be unhappy. You will be unhappy because the patient is arguing all the time. He's complaining all the time. And just do it right, and make all those analyses. This is at least my point of view. Don't take it so serious. But in my point of view, if you invest all your knowledge and everything in the preparation, the execution will be faster and simpler, and you will not have to worry about it. So one of the things with the dental laboratory, you can take the photos. This is the horizontal line is the same as the bipupillar line, and this is the middle one. This is the mistake. Someone made a mistake. It doesn't matter who it is, but this is the tryout of the ceramic teeth, and I'm usually making the photos and I'm drawing over the photos so I can talk with my dental technician what I want. So you can see all the images, not only this one. And I want these teeth on the left side to be a little bit lower, so we can make the greatest work. At least we are hoping it. One of the benefits of dental photography is the color communication, and I will make this as simple as possible. It's not a simple thing we could talk about this the whole day at least, but just to give you a little bit insights. I won't be bothering you a lot, but the whole idea is when you're holding the color key in front of your teeth of your patient, just keep in the same plane of the teeth. And because when the light from your flashes, if you're holding the color key in front of the patient's teeth, the light will be brighter on that color key, and the image won't be right. Why they won't be right? Because the difference in the depth of everything, you have to keep it in the same plane with the teeth. So usually I make those two photos, one with a twin flash that I'm using. I use different type of flashes all the time, and the ring flash, twin flash, and the soft boxes, everything. But it depends on the situation. If I want to be faster, if I want to do something that is more beautiful. But the proper way to communicate with the dental laboratory, this is the simple way, and this is not the proper way, but this is something you can do. It's the easiest way to start with. Just Google about how to communicate with your dental technician with the colors, how to determine that. But using the polar filters is the best way. The picture on the right is taken with the polar filter, and I put the settings on it. Why? Because I want to be fast. I took the first photo with f/25 the aperture. When I put my filters on the flashes and on the camera, I need more light from my flashes, so I just going to get the underexposed image. So what I'm going to do to be faster, I don't want to twitch it with the flashes or anything. I just open up the aperture and I get a second image, and I can go back to work, because the whole idea is the dental photography should help us be faster, better, and more efficient. Not be slower and not bother our patients just with the photographs. Oh, let me take the photographs. You will be faster and faster in time. But that is why I'm telling you all the time, do not learn anything by heart, and if you're starting, start with a mobile phone. Why? Because you will be faster. On the mobile phone, everything is just. Let me just see. I'm sorry. I got a message for the admin. We have a couple of questions. Give the name of the free software. Which software are you using? Sorry. Which software can be used in Android? This is not, if you're talking about the smile planning, I'm not using it on my phone, I'm using it on my laptop, and since I'm using the Keynote is when you're a Windows user, the Keynote is something similar to the PowerPoint. But I have only bought the Mac only because of the Keynote, which is the free software that I can use. And the Keynote is the best software. I can be fast with it. So again, this is something that I show you that I can do. It's not my point to brag about it. If I can do it, trust me, I'm not the smartest person. I'm far, far from it. But if I can do it, you can do it. But you need some education about it, how to do it. And we don't have enough time to talk about it. And I prepared you some more tips and tricks so that I can show it to you. So we can get to the questions later. This is the tips and tricks. If you're interested how to make these kind of images, the pictures, how to do the cross-polar, you need two of these. This is CPL polarized filter lens. These cost around $10. You need two of them. You need to position them in this way. Just the filter goes on the camera on this side, and you use the same filter so you can front to front of the filter, and just moving them around, turning them around, you get these blank points. And the whole idea of these photographs, I love them, but I want to consider myself an artist, and I want to do something differently. And you can see all those images are pretty much the same, because this is the only thing you have to do is to slice your tooth the thinnest as possible. I just grind it, and I broke all my fingers on it to get to the 0.3, and I really respect people who can do that, but I don't have time for it. Not time, I'm just not willing to do so, because I will make the same photograph and it's not making me feel any special. So this is the video that I made. If you position your tooth between the filters and turn it around, I hope you can see this video. It's a little bit laggy for me because we are streaming, and I don't think it can get any better. But this is the way you put your tooth, the slice of the tooth in it, and just rotate the filters. And that is the whole point of making the cross-polar images. And one more thing, how can you make from this same CPL filters the cross-polar filter? You can use the 3D glasses. The 3D glasses, you can buy these from AliExpress or Deal Extreme from about $2. So what I do, when we go to the movies and watching the 3D movie, the lights from the theater are going all around us, all around us. And when you got the glasses are going to make that light straight. So when we break the glasses and put the glasses in front of our flashes in this way, this position, you're getting the straight light from your flashes. That is the whole idea. And so you can make it like this. I make it like this. So I will showing to you how I made this. And the same CPL polarized filter, you put it on a lens. The most important thing, that filter has a white spot on it. So you have to point that spot to the flash, which is on the side, because the filters has to be on 90 degrees. And this is just, you can do it. Is this the best filter you can get? No, it's not. You can buy the polarized. They are not much expensive, but they are made just for that. But you can, if you don't have money, if you want to try with it, because this is the proper way to communicate, this is the best way, you can get these kind of images with your patients, and they are quite fun, and they are excellent in communication with the dental laboratory for the color, but always use the color key, so you can compare the teeth and the color key. And this is something that I did the last webinar with my dear friend Dr. Girish. I don't know if you know the guy, he's from India, he's my brother from another mother. So we did a webinar a couple of weeks ago on his page, The Underdog Dentist. And why I'm here showing you this, because on this webinar we did the comparison of these the most expensive camera, the full frame camera, and the least expensive camera. And why I'm showing you this slide, because this is the axiom, this is not debatable. The larger the sensor is, the better the quality of the photo is. And that is why I'm telling you, if you're a beginner, pay attention again to the most important thing, that is the protocols. And stick with the protocols. Get the retractors, get the mirrors, and shoot with your phone. But when you master your protocols, master your images, and know why are you making all those images, just buy the DSLR camera, or not the DSLR camera. If you're going to invest today, mirrorless are the future. DSLR cameras are gone. And you have to trust me on that one. That is why I was showing you, I was bragging about my work, because I'm into this for a long time. The mirrorless are the future, trust me on that one. But the whole idea is to compare, because I'm always telling my students, which I'm going to tell you now. The most important thing in any kind of photography, especially in dental photography, because the dental photography is the part of general photography. The most important thing is the lights, the flashes. The second important thing is the lens. And all of the people are arguing which is the lens, which is the best lens. Let me buy this lens, let me buy that lens. It's not important. All the lenses for dental photography are good. There is not a bad macro lens, because they're macro. If the lens is macro, it's special lens and it's expensive. I personally suggest always, if you're a Nikon user, go for a Nikon lens. If you're a Canon user, go for a Canon lens. Because the best lens for Canon is the Canon lens, and the best lens for Nikon is the Nikon lens. These are all little computers, and they all communicate with each other. And the whole idea is to buy the same brand, because it will work better and faster. You won't have any twitches when you're working, and that is the whole idea. And every lens is good, remember that. The most important thing is the light. So with my dear friend Dr. Girish, hi Girish if you're looking at it, and of course look at that webinar. I will just show you a couple of things as the finalization of my lecture today. The comparison between those two you can see in the webinar, but the whole idea is to compare the lights. This is one fast photo that I took from this model, and look at this model. So this is not the cheap phone. This is the iPhone X. I paid it €1,000. So the camera is good, but it's not good for what we need. But it's good to start with something. But if I pinch in, when I'm zooming in this case 2.5 times, I can get some decent photo of this model. So the whole idea is to compare it with the cheapest DSLR, the Nikon D3400, which costs, the body only costs 350 euros. Again, check out my webpage, Dental Photography by Dr Milos. I post about the recommendation of the equipment, and I posted on this page, the World Dental Association, also some kind of posts that will help you with your dental photography. So let's stick to the presentation. So this is the best thing I can get from my iPhone. And if we zoom it in, it looks like this. I don't like it, but it's a start because I don't have to think about the settings of my camera. I just take the pictures. And I'm concentrate on what I'm taking picture of and how to analyze those photos and how those photos can help me become better dentist. Because I want to be better dentist, not a better photographer. I'm quite passionate about the photography and I love it. But first thing first. Better dentist than better photographer. Okay, so this is my iPhone with a built-in flash, and again, this is the best thing I can get from an iPhone, and this is the ring flash on the cheapest camera, Nikon 3400. So if I change the ring flash and put a better twin flash, I get these results. So you can see the difference, right? So I have another video on these twin flashes when I put the small diffuser, which cost around $2, and you can get these results. It's not a big deal, but it's a little bit different. So this is the ring flash, again, the twin flash with the diffuser, and this is the standalone flash. What is the standalone flash? Look at the webinar that I did a couple of weeks ago. This is the standalone flash. And how you can use it, I will show you on that video. If you're interested to look at it, you don't have to. So this is the standalone flash naked, without anything. This is the standalone flash with a small diffuser. And this is the standalone flash with a softbox. So you see the difference. We can go another turn on this, so you can spot the difference. So this is the iPhone. Sorry. It's a little bit laggy, I'm sorry. We have to wait for this computer to work. Come on. Okay, so this is the iPhone, right? This is the ring flash. You can see the difference of the model because iPhone has a wide lens of 28 millimeters, and that is why we are using 100 millimeters, because he doesn't distort the image. Okay, let's stick to the subject. iPhone, ring flash, twin flash, diffuser, standalone flash, with a diffuser, and with a softbox. And this is when I zoom in 100%. You can see how this model is dirty. I'm sorry for that, but I cannot see that actually when I'm looking at it. So if we compare, because I get this all the time, do not make the pictures with the softboxes. I don't like it. They are not the medical documentation. Yes, they are. So look at these two images and tell me, where do you see more details? So I know this is fake gums, but on the left image with the soft boxes, you can see the gums, they have volume. On the right one with the ring flash, you don't see anything. Look at the brackets. Look at the cement on the teeth. You can see only on the central incisor a little bit of cement. But on the lateral one, on the canine, with the diffuser, you can see the cement is not right. And look at the lower jaw where I remove the brackets. With the ring flash, you cannot see all the details. But with the soft boxes, you can see all the details. And that is the whole point. Just think for yourself. And the whole point is to help yourself with the presentation, with everything. And look at the model. I hope you can see it because I cannot. And compare the model with the images. And which images The right one. Another one. Because you're looking with a camera from my laptop. So that is all from me today. You can follow me on Facebook. I have a group, Dental Photography, Dental Dr Milos Ljubicic, or Instagram. Go with the questions because I'm here. You can ask me anything about the equipment or this lecture or anything you want. And I hope you like it. I don't know how much of you are watching this because I'm talking with myself for an hour exactly. So can someone send me the questions so I can see, or we can finish for today? I don't know. Just talk with me via the WhatsApp or whatever you like. So I got 4 questions about the software that I'm using. I'm using the Keynote. The whole idea of the Keynote is is free for a Mac user, and I told you I only went with the Mac because of the Keynote, and I wasn't regretting this time because the Mac, this laptop, I have it for 6 years. He's working all the time, and I have 0 problems with it. It's not anything different with a Windows one, but it's a laggier. You can use whatever you want. You can use the whole idea. Which software can be used on the Android? If you're making pictures with your phone, all those new phones have those drawing applications. Just make the picture right. Look at the clinical documentations. Look at the protocols. Look at what we are going to take a picture of, and you can draw with your finger. Just use any kind of application. Use your imagination. You don't have to listen to me. I don't have to sell you any kind of application because today everything is free on this kind of softwares. That is the whole idea. So maybe I don't have any questions if you guys watch it or not. Let's see. So I will wait for a couple of minutes to see if we have any kind of questions. I hope you do. Let me turn on my other computer to see if you commented on it because no one is asking me anything. So just tell me if there is no questions. That's okay. I'm a little bit sad about it, but just tell me so I can stop the streaming. Let's see. So no questions so far. I don't know. Just admins, tell me what to do. Do I finish this streaming or do I wait for questions? I'm not getting anything. Maybe I can sing something. Let's see. Tell me if there is no. Oh, nice question. And thank you for the question. I don't know if my admins ask me the question, so I won't be sad because no one is asking anything. What twin flashes will I recommend? And this is the whole idea. And this is excellent question actually. The most popular flashes nowadays are Meike twin flash. Let me show you the central unit with it. These cost around $300 and they are good. They are excellent. But beware of something because nobody is talking about it. These flashes are working perfectly on my Nikon D800. And this is a 7 years old camera. But these flashes are from my friend Dan Stamenkovic, a colleague of ours, and he bought the new camera, the Nikon 5500, which is the newest camera you can have. So the whole idea is these flashes are not working with his camera. They're working sometimes, they're not working all the time, but they're working sometimes. But if you buy a Nikon for a Nikon, it will work with any kind of camera. And in my experience, and I tried these trim flashes, Meineke flashes, on the D800 they're working perfectly. On the D300, 400, which you saw the images from it, they're not working at all. They're working sometimes, I don't have the pattern, it will make me frustrated if I'm going to use it in the dental office. So the whole idea is to buy the same brand of the flashes. So I will always, if I'm a Nikon user, I will go with the Nikon flashes. And if I'm a Canon user, I will go with the Canon flashes. And let's see, which camera do you prefer for Canon and which could be cheap and the best? Recommendation from retractors, mirrors, camera. The whole idea is to get to the big sensor cameras. You always get what you pay for. So if I buy the best camera, I know how to use it, but will it make my photos better? No, it won't. Ansel Adams once said, again I'm quoting, I'm sorry, but this is the greatest quote. Buying a Nikon doesn't make you a photographer, it only makes you a Nikon owner. And that is the truth. Because learn the protocols, learn your equipment and master it, and you will be better in photography if you learn it. Do not learn anything by heart, because it's not simple as that. It will be the same as I ask you, okay, show me how to prepare a tooth using just one burr. I don't care if it's a inlay, onlay, overlay, crown, or a bridge, just show me. And I want to do it with one burr without anything. It's not possible. Get into your equipment and learn it. How can I get rid of the shadows of extraoral photos? Excellent questions. Shadows occurs if you're using the twin flash and maybe the ring flash and maybe the twin flash. You can use a black cloth. You can put the black cloth behind your patient because the focus will be on your patient and not on the background. And the background, if the background is black, you can avoid the shadows. Another thing to avoid the shadows, and you can look at the webinar that I'm suggesting you to do, the angulation of the light. If you're going to photograph me, if the position of the light is this way, you will get a shadow from me. And if the position of the light are this way, the shadow will be all the way around my head and you won't see it on the photograph. So that is the two ways you can do it. So, recommendation from the retractors, mirrors, I cannot recommend you because I live in Serbia. I have a friends in Interdent, Slovenia. They were kind enough to show me and give them theirs retractors and their dental millers. So I'm using it. I'm quite happy with it. I can recommend it. But I don't know if you can get it from India or wherever you are. If you're in Serbia or Slovenia, I can recommend you guys to go with the Interdent because of the suitcase. I got a suitcase of 5 mirrors. You can see the post I made from it. Because I travel a lot from my lectures and courses, I can easily put it in my bag and don't worry so the mirrors will break. And I bought the cheap retractors also from Interdent. They are plastic, they are transparent, and they are the best. Okay, so which camera do you prefer for Canon? It's a silly question. No, it's a great question, but it's a silly answer because I'm into photography for a long time. I cannot wait for the Nikon R5 to get out. I want that camera so bad. And when the Canon R5 is come out, I will buy it right away. I will sell something of mine. I will sell my car just to buy that camera. I love that camera. I want that camera. So that is the camera I can recommend. And always, buying a camera nowadays, go for the mirrorless. I don't care about the brand. The brand is not important. The important is for you to understand how the camera is working. So that is the whole idea. And I can see we're not having any more questions. So thank you all for watching. I hope you like this video. Follow me on Facebook if you like. Follow me on Instagram if you like. And ask questions. I will be happy to answer. Again, thanks my hosts to make this possible. It was a great time for me. So thank you all for watching and bye from me. Cheers.